In a world where healthcare costs can feel overwhelming, a growing number of Americans are looking for alternatives. For many, traditional health insurance has become a source of stress, with rising premiums and confusing policies. This has led them to explore a different path, one rooted in community and shared beliefs, faith-based health-sharing ministries. These aren't insurance companies in the typical sense. Instead, they are organizations where members, united by a common faith, voluntarily contribute funds each month to help cover each other's medical expenses. It's a model built on trust and a shared commitment to lift one another up during times of need, a concept that feels both old-fashioned and refreshingly new. The appeal of these ministries is becoming more apparent, especially for families and individuals who find themselves without coverage. Imagine losing your job and with it, your health plan. The fear of a sudden illness or accident can be paralyzing. For these people, faith-based health sharing offers a potential lifeline. It presents a more affordable way to manage healthcare costs while also providing a sense of belonging. The idea is simple. Instead of paying a premium to a large corporation, you are sending a monthly share that directly helps another member pay for a surgery, a hospital stay, or the birth of a child. This direct connection fosters a powerful sense of purpose and community. This growing trend is not just a fringe movement, it's a significant shift for many. According to recent reports, over 1.5 million Americans are now part of these health-sharing communities. They are drawn by the promise of lower monthly costs and greater control over their healthcare decisions. In a system that often feels impersonal and bureaucratic, the idea of a support network that shares your values can be incredibly comforting. Members often receive not just financial assistance, but also prayers and letters of encouragement from the very people they are helping and who are helping them. It's a human touch that is often missing from the modern healthcare experience. As traditional healthcare systems face challenges, from policy changes to economic pressures, the conversation around alternatives like health sharing is getting louder. The Congressional Budget Office has projected that millions could lose their health coverage in the coming years due to changes in programs like Medicaid and the ACA marketplace. This potential gap in coverage is pushing more people to seriously consider options they might have overlooked before. They are asking important questions about what security truly means when it comes to their health and well-being. And for some, the answer lies not in a policy, but in a promise made between fellow believers. So how do these faith-based health-sharing ministries actually work? It starts with a monthly contribution, which members call a share rather than a premium. This amount can vary widely, often depending on your age, your family size, and the level of sharing you choose. For a single person, it could be under $100, while a large family might contribute several hundred. This money goes into a pool of funds that is then used to pay for the eligible medical bills of other members. Before the group starts sharing costs, each member is typically responsible for a certain amount of their own bills, similar to a deductible, which is often called a personal responsibility amount. Membership in these groups comes with specific requirements that go beyond just paying your monthly share. Because these are faith-based ministries, members are usually required to agree to a statement of faith and live by certain ethical and moral standards. This often includes commitments like attending church regularly and abstaining from things like tobacco, illegal drug use, and sex outside of marriage. These rules are central to the model because they are based on the belief that a healthy lifestyle, guided by shared values, can lead to lower overall healthcare costs for the entire community. It's a framework that asks members to be accountable to one another. When a medical need arises, the process is quite different from using traditional insurance. Some ministries, like MediShare, operate a central system where they collect the monthly shares, negotiate medical bills with providers on behalf of the member, and then pay the bills directly from the shared funds. Other groups, like Samaritan Ministries, use a more personal, peer-to-peer approach. In this model, when you have a medical bill, you are told which other members to send it to. Those members then send their monthly shares directly to you, often with personal notes and prayers included. This creates a direct, tangible connection between the person giving and the person receiving help. It is crucial to understand that these ministries have clear limits on what they will and will not share. Costs for procedures that go against their shared religious beliefs are typically not eligible for sharing. This can include things like abortions, contraception, fertility treatments, or medical issues arising from activities the group deems unhealthy or immoral, such as alcohol or drug abuse. These exclusions are spelled out in the membership guidelines, which act as the rulebook for the community. It is essential for anyone considering joining to read this fine print carefully to ensure they understand exactly what is, and is not, covered by the group. To truly understand the impact of these ministries, consider the story of the Noble family. Their 20-year-old daughter, Reagan, a talented college soccer player, faced a devastating injury on the field, a torn ACL. An injury like that is heartbreaking for any young athlete, but it also comes with a mountain of medical bills. The surgery, physical therapy, and follow-up appointments quickly added up to a staggering $70,000. For most families, a bill of that size would be a financial crisis, causing immense stress and uncertainty. But the Nobles were members of a health-sharing ministry called Samaritan Ministries, and their experience turned a moment of fear into a testament of faith. The family submitted Reagan's medical needs to the ministry, following the guidelines they had agreed to when they joined. What happened next was a powerful display of community in action. Following the peer-to-peer model of their ministry, the Nobles began receiving checks in the mail directly from other members across the country. Each envelope contained not just a payment to help cover the medical bills, but often something more: a personal note, a card with words of encouragement, or a promise of prayer for Reagan's recovery. It transformed the process of paying bills from a cold transaction into a warm, human connection. This support was not just emotional. It was incredibly effective. Within just 4 months, every single dollar of the $70,000 in medical expenses for Reagan's ACL surgery was paid in full by the shares sent from fellow members. The family didn't have to fight with an insurance company or spend hours on the phone negotiating payments. Instead, they watched as a community of strangers, united by a shared faith, came together to lift them up. This experience solidified their belief in the health-sharing model, seeing it not as a risk, but as a reliable and compassionate support system that worked exactly as promised when they needed it most. Reagan's story highlights the core promise of faith-based health sharing, that a community bound by common values can provide for one another in powerful ways. While critics rightly point out the potential risks, stories like this one demonstrate the profound benefits that many members experience. It shows that for some, the combination of financial relief and genuine, prayerful support offers a sense of security that goes beyond what a traditional insurance policy can provide. It's a reminder that behind the big numbers and policy debates, healthcare is ultimately about people caring for people, and these ministries are built on that very idea. When considering a faith-based health-sharing ministry, it's a bit like looking at two sides of the same coin. On one side, you have some very clear and attractive benefits. The most significant of these is often the cost. For many families, the monthly share amount is considerably lower than the premium for a comparable private insurance plan, making it a more accessible option. Beyond the financial savings, there is the powerful, intangible benefit of community. Members often speak of the immense comfort they feel knowing they are part of a network of people who share their core beliefs and are committed to supporting one another through prayer and encouragement, not just money. However, it is absolutely essential to flip that coin over and look at the other side, which holds the risks and limitations. The most important thing to remember is that these ministries are not insurance. They are not regulated by state insurance departments, and there is no legal guarantee that your medical bills will be paid. If a ministry experiences a month where medical needs are unusually high, they may have to prorate payments, meaning members might only receive a portion of the funds they requested. In such cases, Members might be asked to vote on whether to increase their monthly shares to cover the shortfall, but payment is never a certainty. Another significant risk lies in the detailed list of rules and exclusions. As we've discussed, these ministries will not share costs for pre-existing conditions, at least for a certain period, or for treatments that conflict with their statement of faith. This means if you have an ongoing health issue or need a procedure that falls into one of their excluded categories, you could be left with the entire bill yourself. This lack of a safety net for certain conditions is a major trade-off for the lower monthly costs. Potential members must be completely honest with themselves about their health needs and lifestyle to determine if the ministry's rules align with their life. In the end, the decision to join a faith-based health-sharing ministry is a deeply personal one that requires careful thought and research. For healthy individuals and families who align with the required faith and lifestyle commitments, these ministries can be a wonderful, affordable, and spiritually fulfilling alternative to traditional insurance. They offer a unique blend of financial practicality and genuine community care. But for those with chronic health conditions or who may not fit the strict membership criteria, the risks could outweigh the rewards. As the landscape of American healthcare continues to change, more people will likely weigh these pros and cons, searching for the path that best secures both their health and their peace of mind.